Hello everyone, welcome back to this channel and thank you for tuning in to this channel. This is Grapharm Academy where we deal with a number of course units that enable you develop your profession, and those who are already practicing in the field, it enables you to build what you already have. So today we are going to look at what we call counseling for pharmacy staff, but not necessarily pharmacy staff, even any other medical staff needs to have the skills of counseling. So I'm going to start with a story that can enable us tune to the advantages of counseling and why we need to counsel our patients. So one time, a patient by the names I may not disclose, okay, always lived with a busy life, balancing. Of course, we look at the busy life involves balancing the work, okay, demanding work schedules, and then busy social calendar, and his health often took it for granted. He would feel maybe weird, he would feel like he's not well, but he would just ignore it, okay? But when he started feeling fatigue, experiencing frequent headache, and noticing strange weight fluctuation, he became concerned. Okay, so his usual remedy was to push through, like push through with the symptoms and try to manage, socialize, maybe go and booze, something like that. So hoping that the symptoms would disappear, but weeks passed and this condition only seemed to worsen. So finally, after a visit to a pharmacy care doctor, or maybe a pharmacy personnel or a dispenser, a person who is at the pharmacy, is when he was advised from there about his condition after him explaining to this personnel. So when he was counseled about his condition, and what he was supposed to do in order to avoid this specific scenario, or avoid these alignments or these symptoms, so that they can elapse, or so that they can like stop. So you find that this personnel uh, educated this person about what could be the underlying causes of his illness, and then also gave him a recommended dosage of what he can take. And guess what? This patient got better, and afterwards, of course, a patient like came around and thanked the doctor because the person was given even management, like maybe non medicine or treatment management skills to manage his underlying symptoms, and also to manage his day to day like work schedules and social life and a busy life altogether. So you find that counseling becomes a key treatment guide that you need as a personnel to counsel your patients, to always be there for your patients and guide your patients. Okay, so today we are going to look at what do you need to know about counseling for these patients. What do you need to equip yourself with when you are counseling patients? Okay, so let us look at what is counseling. Counseling involves giving your patient information and guidance on their medicines and allowing them to make informed decisions. So, what about guidance? Is the help given to an individual to enable him or her make whatever adjustments or readjustments necessary in order that they or he may achieve individually and social desirable satisfaction in all his activities, just like a scenario that I have just given you. By you knowing what counseling is, you have been doing it without knowing that you are counseling a patient. Not only patients, you may also counsel people around you. Can be your family members, can be your friends, can be anyone around you, your colleagues, maybe at workplace or maybe in school, like in college, in the university. So you need to have these skills. So what's the aim? Why would we counsel patients? What's the main aim? So the aim of counseling patients or counseling patients, I don't know, depending on how you pronounce it encourages a patient to identify any problems they perceive with medicines and also any solutions to these problems. Okay, encourages patients to develop their own action plan for taking and using medicines correctly. All right, then it gains an understanding of the patient's perceptive, like you are able to understand the patient perceptive about their symptoms, about their work schedules, about not necessarily work, maybe the busy life. You are able to know more about the patient because you are interacting with your patient directly. Okay, respect the patient's belief and non-judgmental to their use. You should not judge a patient based on what they tell you. Okay, because these patients to open up to you, that means they trust you as their medical practitioner or personnel or caregiver. So if patients do not take their medications correctly, they will not benefit from them. All right. So why should we counsel patients? You need to provide advice on the side effects they may experience from their medications. You can also advise them on how to use their medicines and the first time they receive it. Important also to check they are using it properly on subsequent visits to the pharmacy. You need to always check, all right? Then medicines may interact with other drugs. So you need to tell these patients about whatever reactions, in case of adverse drug reactions, they need to report back to you. In case of any other side effects and they are not going, or maybe they are life threatening, they need to report back to you so that you protect them from maybe further damage of organs or physiological change in physiological functions. Okay, so many patients are receiving substandard care because they find their medicines difficult to take or hard to remember because they do not have anyone to talk to them about their medication. So it is necessary for us to talk to these patients. We are trained to do that. So we have a responsibility to guide the patients, to talk to patients, get their perception, know your patient personally. Okay. I hope you don't misunderstand the personal thing. All right. So we are continuing with the importance. We see that you reduce medication errors, increasing patients' understanding and management of their medical condition, minimizing incidents of adverse drug reactions and drug-drug interaction, also improve patient outcomes and satisfaction with care. Improves compliance and adherence. We have a lecture on this channel on compliance and adherence. In case you have not yet watched it, kindly check it out in this same channel and have a chance to understand what compliance and adherence to medication is. Reduce healthcare costs. It is a physiological therapy and it enables your patients or clients realize the stress and anxiety that they are going through. Okay, so what are the opportunities for counseling? A pharmacist and a pharmacy technician and probably a pharmacy assistant should take a prominent and proactive role in counseling. All right. So the main opportunity for counseling is at the end of the dispensing process or when the medicine is being sold. All right. So if you're in a private setting, like you are selling or you are giving medications in exchange for money. But if you are in a public setting, you find that you are dispensing freely the medications freely to your patients. That is in public setting or public health sectors. So in any of these stages, all right, let us not focus on what we get, like the money, maybe based on our boss, he may want you to have a specific skill or cash at the end of that time, and then we end up forgetting to tell our patients what they need to know. Counseling our patients, hearing from our patients, making them comfortable. All right. Because counseling for somebody to open up, you have to first make them comfortable. Yeah. So what are the qualities of a good counselor? You need to be knowledgeable, know what you're talking about before you talk about something. Have the knowledge about what you're going to say. Excellent communication skills. You need to have communication skills. Should be a good listener. You should not judge this patient, and you need to look at your facial expressions, nonverbal communication. Very important, because most of the time we are judging basing on nonverbal communication, and yet these patients are able to see or to read our nonverbal communication. And some of them are health practitioners, only that they are not in their uniform at that time, so they be knowing how you're handling them, and they can have a perception about your facility. Should be able to solve the problem for the patient. All right, patients should have patience with your patient, and also be flexible and warm. All right. um you should be polite in what you say or do. Be sensitive, empathetic, and then sympathetic with your patients and clients. And then you should be confidential. Like, do not disclose whatever you've discussed with your patient to, even if your even your workmates, unless it is necessary, unless you need to get their view about something. So personal integrity should also be portrayed. So what are the counseling skills that you need to have? You should have attending behavior, should have interviewing skill, you should have active listening skills, and then probing skills. You should be reflecting on feelings, and then praise appropriate practices. Talking skills, you should have them, and then summarizing and paraphrasing skills. So what's the information or advice to include when you're counseling? Name and the strength and the dose of the medication, how to take and use the medication, when to take or use the medicine, how much to take or use, how long to continue to take, and what to expect. All right. Why the medicine is being taken or used, what to do if something goes wrong, and then how to recognize side effects and minimize their incidences, lifestyle changes which need to be made, potential precautions, contraindications, drug-drug interaction, including non-prescription and herbal drugs, dietary changes which need to be made, and then proper storage and prescription refill information have to be given to your patient. So we are continuing. Do not break. Don't break an enteric coated tablet for easy swallowing. All right, we all know the reason as why it is enteric coated. All right, so this majorly we are going to look at some of the lectures to explain these coatings and why they are done. With medications in suspension form, check the bottle uh like before use. All right, and we all know why we need to shake this bottle before it is used. How to remove medications from the pack and use, for example, maybe a blister strip pack. How should they remove it and swallow it so that you avoid it getting damaged? How to fit in the dropper assembly and use. Okay, so for those medications that have droppers, how do you use that dropper? For example, we have nystatin syrups for children, and you find that most of the mothers may not know how to use it. You have to explain to them how these droppers are used, and after using, what do they do? All right. To specify whether the medicine is for internal or external use, you need to tell your patients what are the considerations of the medicine. Consider counseling if the drug has a narrow therapeutic index. All right. Also, the potential to interact with another drugs or food. You also have to counsel your patients, and then potential to cause side effects. Those medications that are in position to cause side effects. Tell your patients in advance so that they are prepared psychologically for these side effects. Special storage conditions that you need to give to your patient have to be clearly noted. So counseling should also be done if it is recommended by the reference source, such as British National Formulary, that is the BNF. So we are continuing with considerations of the patient counseling. Is the patient known at the pharmacy and had previous problems with drug therapy? These are questions like you're going to ask yourself before you start speaking to the patient. What counseling have they previously received? And then what are the patient's comprehension levels? All right. What level of support do they have or need? How old is the patient? Because you need to know the age in order that you don't waste your words. There is a specific age that will not perceive whatever you're going to tell them, will not understand. For example, when you look at children below maybe 10 years, they are not going to understand what you're going to say. But if you look at adults and those maybe 15 and above, will comprehend what you're saying. And most of the time, you may need to counsel the patient in order to get consent from them for you maybe to carry out a specific procedure on them. So there, you need to also know the levels and the stage where you need to get consent and which people need you to what to get where you need consent from. All right. So you need to know all that and have it at the back of your mind. Are they pregnant or breastfeeding? And then do they have any disabilities? Are they known to be poorly compliant to medications? So when a patient who has brought in a prescription wants to also buy an over-the-counter medication that will interact with the medication, what do you tell such a patient? For example, a patient on warfarin who wants to buy aspirin. We know this has drug interactions in it. If a patient brings in a prescription for more than one medicine and asks for one or more of them not to be dispensed, indicates poor compliance, all right? So if a patient wants to buy an over-the-counter medication to relieve the side effects of the prescription medication, what do you tell them? For example, a patient taking diclofenac who wants to buy something to treat the indigestion that comes about with maybe diclofenac. So patients with a terminal illness and relatives of the patients, for example, having HIV/AIDS and cancer, like how do you counsel them? Patients who are on medications for the rest of their life, all right? There are those patients who are always coming to refill the medications. What do you tell them? How are you going to talk to them? What is the choice of words you're going to use for this type of patients? Family planning clients, how are you going to talk to them? Women with abortions, all right? How are you going to talk to these ladies? Maybe they're coming back with side effects of these abortions and they try to do it on their own. And now they are coming, maybe they're bleeding and the side effects are many. What are you going to tell them? How are you going to counsel them? Those with weak personalities, all right, how are you going to deal with them? Addicted clients, all right, you should be in position to know what to do. So how do we counsel the AIDS patients? So patient information on the leaflets can guide you or can guide. In the UK, we must give a leaflet out with every medicine dispensed. They will have a chance to read these leaflets. Okay, if they are not available, consider writing your own information leaflets on how to use the eardrops, the eye drops, pessaries, suppositories, and inhalers. Give the patient information on how to use these specific medications. Yeah. What about a placebo device? For example, a placebo inhaler. We should all appreciate what a placebo is. All right. So useful for demonstrating correct inhaler technology or techniques to patients, and for checking that patients are using them correctly on subsequent visits. So a placebo is a medication that doesn't have a therapeutic effect in it, but you can use it to demonstrate to a patient on how they can use a specific medication that you want them to use. That is a placebo. What are the stages of counseling? There are majorly 3 stages. The following steps are some of the ones you have to follow: introduction, process content, and conclusion. So what happens in introduction? Review the patient's record, obtain drug-related information such as allergies, use of herbs, all right? Assess the patient's understanding of the reason for therapy, and then assess any actual or potential concerns or problems of importance to the patients, all right? So what about in process content? What do you do there? Medication information exchange. Use the language that the patient understands, and then use appropriate counseling aids. All right, you can use charts, you can use diagrams, you can use pictures for a patient to be in position to understand what you're going to tell them. Present facts and concepts in simple words and in a logical order. Use open-ended questions when you're counseling your patients. Check patients' understanding by getting feedback from them. You can ask them a simple question for you to be in position to understand or get a feedback from them. Summarize by emphasizing key points. Give opportunity for patients to put forward any concept. Help the patient to plain follow up. So the summary of what you need to know, we can put it in an abbreviation or something that you can remember easily, and that is gather. All right. So whereby gather, G represents greet your patient or client. Before doing any procedure, before even asking them what they are suffering from, it is very important to welcome your patients with a smile and greet your patients or clients. All right. Ask the patient or client about him or herself. Ask them. This enables you to find out who this patient is, gives you a perception of what a patient, which type of a patient you're going to deal with before you pour out content. You may pour out content when you have not understood which type of patient you're dealing with. Is it the patient that needs special attention? Is it the patient that you need, or maybe may know much information and you may need to just add a little? Like, tell patients, T represents tell a patient or client about proper use of medication, and then H represents help your patient or client to understand instructions. E represents explain how to use the medications to your patients rightly, and then return for follow-up. You need to do the follow-ups. What are the barriers to effective counseling? There is physical barrier, for example, uncomfortable sitting arrangement, all right? So some counseling sessions, you find that the distance from you and a patient is like small, so a patient gets uncomfortable. Mostly if a gent is talking to a lady or a lady talking to a gent, the non-verbal communication comes in and a patient may get uncomfortable. So it is advisable to leave space, have a table where you're going to sit, or have a counter. That's why most pharmacies have counters, so that you have that space. A counter alone gives you a space between you and your client. Okay, and make sure that a client is comfortable. Difference in social and cultural backgrounds, for example, beliefs, the number of beliefs that may be a barrier to counseling, because there are some things you may not have to mention. Nonverbal communication, for example, showing signs of disgust, like you're disgusted. Yeah, nonverbal communication, you have to protect your nonverbal expressions and just remain neutral for you to deliver an effective counseling session to your client. Barriers caused by patients or clients, lack of interest in being counseled. All right, you can solve this lack of interest if you are ready to change this patient's perception of what they have been told about counseling. Lack of trust and confidence between counselors and clients, and then most of the time language barrier. Okay, so in conclusion, what do we need to know? Counseling is an important part of the role of a pharmacy staff, which benefits the patient. Counseling must be structured and the key information should be given so it is easily understood by the patient. Counseling should be used to reinforce the labor and compliance and warn against potentials for interactions. Some groups need special counseling. For example, the elderly, the patients of ill children, you need to counsel them like the caretakers for those children. Sometimes the amount of information given has to be limited to avoid confusion. Most of us pour a lot of information to the patient, and yet a patient by the end of the day gets confused and doesn't know which information to take. Patient understanding must be checked, all right? Always do the follow up. Has your patient understood what you're talking about? And if not, what do you need to do next? Counseling is not a lecture, that you have to appreciate it. A patient must be given a chance to ask questions. All right. Even a lecture, you give a chance to ask questions, but remember there is a difference between a lecture and a counseling session. All right. You have to make the patient comfortable. That's the thing. Thank you so much for listening to this lecture. If you came this far listening to this lecture, we appreciate you for your time. Kindly subscribe, like, and share to content in this channel. And if you're new, you're most welcome. And if you're new here, we appreciate you coming around. Please stay around. Thank you so much. Subscribe, like, and share to content in this channel.